Hello, my name is Eua Matautia. I decided to build off a couple of cases that we did during the semester and create Erik, who is a 70-year-old male, 78-year-old male with a history of kidney failure, respiratory failure due to being a lifelong smoker, and suffers from blood clots. So kidney failure is also known as renal failure. This begins when the kidneys are not able to do their job properly, not being able to filter products like toxins and any excess fluids from the blood. The cause of kidney failure could be due to fluid imbalance, accumulation of excess fluid in the body, which leads to edema, where your limbs kind of blow up, and when you press on it, it like creates an indent. So like that's edema. There's too much fluid in the body. Um, it can cause increase to blood pressure due to the fluid overload. So um, high blood pressure. Um, another thing would be waste product accumulation. So anemia, accumulation of nitrogen waste products in the urea and creatine. So like there's just too much toxins in the kidneys that um, the the kidneys can't filter properly and do what their job is to do. This could be because you're not drinking enough water, or it could be due to alcohol consumption, just drinking all juices, sugar, um, soda, too much soda, not enough. Again, hydration. The third one I put down is the acid base imbalance. The kidneys lose the ability to excrete hydrogen ions and reabsorb biocarbohydrate, which leads to acidic blood. This could also cause the patient to um, have hemodialysis and get their blood transfused. So kidney failure affects and disrupts the body's homeostasis essentially and affects several um, physiological systems due to the kidney's role of filtering that waste. The second one, respiratory failure. In this case, Erik has been smoking since he was in his 20s. This is most likely due to his respiratory failure. With that, smoking damages the respiratory system, causing structural and functional damages. So respiratory failure causes one, chronic obstructive pulmonary disease, so COPD. See this all the time in the hospital. Smoking causes inflammation and damage to the airways, like the trachea and the alveoli. Um, Basically, just the alveoli are not able to like contract to their potential size because we'll go into the next one on why. But it can lead to chronic bronchitis and cause destruction of the impaired. The second one would be impaired mucociliary clearance. So basically, smoking damages the cilia that lines the whole respiratory tract. That includes the nose, the mouth, the pharynx, the larynx, the trachea, bronchial tubes, bronchioles, and the lungs themselves. This impairs the clearance of the mucus and the debris. And the third one would be the pulmonary hypertension. Smoking induced hypoxia leads to vasoconstriction of the pulmonary arteries that will cause a strain on the heart and less oxygen to the body. So hypoxia is basically there's more CO2 and not enough oxygen accumulation, basically. So then it becomes very toxic inside. Basically it just leads to lung failure, and like the tissues of the lungs will get even softer and just so easy to tear through. Um, yeah. And the third one, blood clots. Blood clots are also known as thrombus. That is a mass of platelets, fibrin, red blood cells, and white blood cells. Blood clots are a response where the body begins to repair itself due to injury. This is very important to stop bleeding when the blood vessels are injured, but can become extremely dangerous if it is traveling internally. Blood clots can affect, first one, deep vein thrombosis. Blood clots form in deep veins into the legs and can travel into the heart or brain. I gotta fix that, sorry. The second one, it can cause a heart attack. A clot in the coronary arteries block the blood supply to the heart muscle. The heart, the way it pumps between the valves and the arteries, it can't handle a lot of blood at one time. And so when a clot comes in and blocks it, it will disrupt the flow of the heart. It can cause a backflow. It can cause the flow to stop and accumulate more inside those arteries. Which will kind of put the heart into like a seizing mode, and essentially causes a heart attack. The third one would be a stroke. A blood clot can block the flow, causing an ischemic stroke. These can cause neurological deficits, paralysis, or death. We have fluid in our brain or in our cranium, and so when a blood clot comes and disrupts that area of fluid, your cranium fluid, I can't think of it on the top of my head. It also does the same thing where it puts the brain into like a seizing mode, and it's not able to do its job properly and flow. We need things to flow. Again, blood clots are a good thing. They can obstruct the blood flow, causing tissue ischemia and damage. They they are also and can be very dangerous to us if one, they're not treated, or two, we just don't know what's happening. These three things. In this result, this is a little morbid, and I'm sorry. But Erik is a 78-year-old. He will eventually die to one of these diseases, most likely from the respiratory failure, in my opinion, or from his kidney failure. I kind of just made this stuff up with an accumulation of patients that I see in the hospital. Um, he's old, 78, he's by himself, he has no family. His body can no longer repair itself like it used to. He's been battling and making appointments to his making his appointments for hemodialysis. So he couldn't get picked up by the handy van. Nobody could have taken him. He had to basically figure out on his own. So that causes him to be in and out of the hospital a lot. Because of his respiratory failure, and has been a chronic smoking since he was 20. He's almost 80 years old, so that's 60, almost 60 years of smoking cigarettes. He has to have an oxygen tank with him wherever he needs to go. He does have prescribed albuterol, but that's an only temporary fix. And with his blood clots, they are being well managed by taking ibuprofen. But again, one of these things will take Erik's life. It won't be because of old age. It will be because of one of these diseases. Thank you so much. This is my case study and my media project. I hope it was entertaining.